So here you're checking, you're confirming. You're not saying, I can see your name is Amy Home. People have filled this station because of that. Rather, you're gonna get other things you want to bear in mind are that number one, you want to note the time the last vaginal examination was done, and this would inform whether you will be doing a vaginal examination or not. People fail this station because they fail to realize that a vaginal examination was last done at 5:30 in the morning, and then this is 9:30. There is a 4 hours gap in between, which means that you should actually do a vaginal examination. But sometimes people don't pay attention to the time, and you go through the assessment station without doing a VE. That means automatically means a fail to the assessment station, and not just the assessment station, the planning station also goes along. It's also going to be a fail because you haven't assessed correctly then, which means you can't plan correctly. So that is one thing you want to bear in mind in this station. Hey guys, welcome to my channel once again. My name is Omobeejay, and I would like to welcome you to another video in the Midwifery OSCE, and gradually we're coming to an end of the series, and I am excited. Like when I started it, I did not know how I was going to be able to come this far, and let me not even lie, this latter part is really looking like I promised I was gonna do it. I'm not giving up, so I'm gonna bring myself right here and finish it up. So yeah, we'll just be going through the last series of videos in the next couple of videos. So we'll be going through the assessment station. We've got the evaluation. Okay, we've got the API pending, and I've got the professional value station. So that's like 5, or that's like, those are like 5 stations, or maybe 4 stations, because the IM also covers for implementation station, to be fair. So basically we have about 4 videos pending. So in today's video we'll be going through the assessment station. In the assessment station, I understand that we have the antenatal, the labor, and the postnatal API. I was thinking we'll do it like separately, postnatal, antenatal, and then the last one. But you know what, everything is just gonna all be in one video. I really do hope it's not going to be a too long video, but I promise you that you'll find value in the video and you'll get everything that you need to know about each of these possible scenarios. Without wasting so much time, we're just gonna go right into it. Yes, so just like we know, the assessment station could be 3. It could be either, you could either get an antenatal scenario, a labor and birth scenario, or a postnatal scenario. It's pretty much similar, to be fair. It's just that the focus in each of the scenarios differs. So as always, I have the marking criteria for each of the 3 of them. So this is that of the antenatal API, and this is that of the labor and birth API, and I've got that of the postnatal API. So it appears like it's on the labor and birth API we have 14 items. On the antenatal API we have 10 items that has A and B and A and B and B and C and D and E. Because I'm like, how will this be 10? But I can see A, B, C, D, E. So yeah, but we'll go through each one of them. And on the postnatal one we have 16 items. So we'll just start from the antenatal API now. So when we get to the subsequent ones, if there is anything that we've probably touched in the antenatal API, we won't just dwell so much on when we go through the rest. Okay, so number 1 assesses the safety of the scene and the privacy and the dignity of the woman. So there, that is where you do, I assess my scene for safety. I'm going to check for any hazards of slip, trips, or falls, and I'm going to provide privacy for my patient. So you draw the screen and provide privacy. So basically that's what you're doing there. I'm so sorry, I've got this bad cough in the last couple of days. So if I sound croaky or I'm coughing in between, that's why. Okay. And the second thing on here says cleans hands with alcohol rub or washes hands with soap and water, dries with paper towels following WHO guidelines. Yeah, we know that already. You wash your hands according to the 7 steps of hand hygiene by WHO. Palm to palm, back of the hands, fingers interlaced, fingers interlocked, rotation of the fingers against the thumb, and then you leave your hands to dry. Introduce yourself to the woman, stating name and role. Hey, Amy Hall, I am Bolaji. I'm your midwife for today. It's as simple as that. That's a point on its own. So you're not just jumping right into the patient and doing what you need to do. You need to like create rapport with your patient, with the woman, and let her know who you are, what is your role. So you check ID with the person's name is essential, and either the date of birth or hospital number against the wristband where appropriate, and documentation. So here you're checking, you're confirming. You're not saying I can see your name is Amy Hall. People have failed this station because of that. Rather, you're gonna have your documentation in your hand, and then you ask the woman, can you confirm your name and your date of birth for me, please? And then she'll tell you, my name is Amy Hall, date of birth 1st January 1985. And then you say, okay, I can check my documentation and I can see that you are Amy Hall, date of birth 1985. Are you all right for me to check this against your allergy band as well? So you're checking against 3 things. The woman is verbally confirming, you're checking against your documentation, and then you're also checking against the wristband that the woman has. So you check Amy Hall, date of birth 1st January 1985. I can confirm that I have the right patient with me. That is that station. So checks for allergies verbally and on wristband when appropriate. If the woman has an allergy, she'll have a red band on, but she could have an allergy in her documentation and she does not have a red band on. So that is why you still have to check and confirm and reassure the mom. So if she has a red band on, then you know she definitely has an allergy, and then you say, okay, even though you are checking and you know, you still need to ask the woman to verbally confirm. So have you got any allergies, Amy? And Amy will say, oh no, I'm allergic to codeine. Oh, the next thing that follows that is what happens when you use codeine, and then she'll tell you nausea and vomiting, and then you say, okay, yes, I can see that on your allergy band as well. We won't give you any codeine throughout your period of hospitalization. That's like some form of reassurance, something like that. And if it happens that the documentation says the woman has allergies, but she doesn't have a wristband on, still confirm. So, Amy, do you want to confirm to me if you have any allergies? And then she'll tell you, oh, I have allergies codeine. Oh, I can see that on your documentation as well, but you don't have a red band on. I'll try to get a red band in place for you. Or if she says, I'm allergic to codeine, oh, it's not on your documentation, I'll update your records and would ensure that we don't give you any codeine. Something like that. Like, just give that form of reassurance and like you know what you're doing. So the next thing is reviews history, confirm situation, presenting symptoms, parity, gestation, presenting pain as appropriate. So you definitely have your the scenario. So you definitely have the scenario where you review. So you go through all of that history with the woman, and when you're going through the history, please when you're going through the history, don't verbalize what you did not see. Don't assume that, oh, this is what they want to say and this is the beginning of it. I know already. Read it out exactly what you can see. Don't assume things, okay? Someone has failed. Okay, this was implementation station anyway, but in implementation station, you still have to review the history, review the paperwork with the woman. And no, in implementation station, you still have to read out the medications before you dispense and all of that. The woman was prescribed ferrous fumarate, but she read out ferrous sulfate, and that was why she failed that station. So you don't want to read out something you did not see or something that was not in the paper. And to be honest, I also made a similar mistake in my exam. So it is very easy to actually make that kind of mistake. It was only God that saved me. The way God saved me in mine was, I think I was reviewing the history and I asked the woman something. I really can't remember. But the way it was, you would think that I asked the wrong thing so the woman can confirm. But in the actual sense, I actually read rubbish.
What exam tension can cause, eh? It is well. Me, God help us.
Say now you're confirming the situation. So Amy Hall, can you confirm to me what brought you into the hospital today? And then she'll tell you, I had sex this morning. And she's gonna tell you, okay, she's been bleeding. Okay, it is a this is an antenatal API situation. So for antenatal API situation, you could have, like the mock scenario gave us, a vaginal bleed at time. She could tell you that, oh, okay, she had sex with her husband this morning and then she has been bleeding since then. Yeah, that's it. And then she's also had pain. She's just paracetamol, and she'll tell you what brought her. She's probably here because the pain is not subsiding and then she's still bleeding, something like that. So you review what brought her. Don't assume that you have the paperwork in your hand of what brought her. You should still ask her to say it with her mouth what brought her. So the next thing says 6B confirms background medical history, obstetric history, medication. That is where you have to go through the paperwork with the woman. I think I even mixed them up. And then the next one says gains consent and explains reasons for assessment. So you're telling Amy, are you all right for me to assess you at this time? And the reason is just to see why this bleeding is persisting, like to see if the baby is okay, to see if you're okay. So it's gonna inform like a decision on how to proceed with your care so you can feel better, something like that. So you're getting consent from her and you're letting her know why you're assessing her. So you complete a full antenatal assessment. So what is inside this full antenatal assessment now? 8A says verbalizes maternal observations, blood pressure, temperature, pulse, respiration, oxygen saturation, and any pervaginal losses. So you're doing the maternal hubs. That's when you do the blood pressure, you do the temperature using the tympanic thermometer, the oxygen saturation, and then you ask her any vaginal losses. That's where she will probably tell you that, oh, she's still bleeding. You ask her, does she have a pad on? What's the bleeding like? Is it only where she wipes? Is it a lot? And if she says she doesn't have a pad on, you might want to tell her, oh, okay, are you all right to have a pad on, so we can have like a way to assess it, to monitor it, something like that. So you verbalize the maternal observations. You can ask your assessor as you go on. The assessor, can you confirm the blood pressure, the pulse, respiration, and hold to me? I would advise and I would suggest that you ask as you go on, because sometimes the assessor will tell you that they'll give it to you at the end, but at the end you are beginning to rush, so you might not remember to ask for all the things that you need, and that might affect your planning station, because you might not have all the information that you need. So you don't want to put yourself in that kind of situation. So I would suggest that you ask as you go on, just as you do it in real life. As you get your blood pressure, you note your blood pressure down. As you get your respiration, you note your respiration. So you're asking your assessor for each of those things as you go. Then after you've done all of that for the mother, accurately performs observations to assess fetal well-being. So for the fetal well-being, you go on to, it's a pregnant woman, so you do the abdominal palpation. Before you go on to palpating, you want to inspect the abdomen, the linea nigra. Has she got any previous scars? Has she got any striae gravidarum? Like just like a physical inspection of the abdomen before you go on to palpating. And when you palpate, you're looking for we know these things already, but you verbalize all of them. You're looking for the lie, the position of the basement, the engagement. You do all of that in the abdominal palpation. Then you go on to listen to the fetal heart rate for 1 full minute, and you have to verbalize that you would correspond that the fetal heart rate with the maternal pulse, to be sure that you're not getting the maternal pulse. That is something you don't want to forget. I'm sure we know these things already, but do not forget. So, and then you ask the woman about fetal movement, because it's a pregnant mom. For this station, you're asking about fetal movement a minimum of 2 times at the start, like before you start your assessment. Okay, when you're asking, so mom, are you in pain? Can you assess your pain? So when you're assessing mom, one thing that was not stated here will be pain. And we know pain is the 6th vital sign anyway, so you want to ask about pain. And the 7th thing you want to ask the mom about is going to be fetal movement. Does she have any concern with fetal movements despite this vaginal bleeding she's having at this time? So you ask about fetal movement again, and then you consider continuous cardiotachograph if required. Because it's antenatal scenario, you want to measure the symphysiofundal height. Yeah, so for me, the way so I don't end up missing anything out. It was more of after you're done with the mother and then you've inspected, before I go on to palpation, the first thing I want to do is to measure the symphysiofundal height and then go on to palpation. Put on disposable gloves and aprons. That's PPE. You must have even done all of that before you go to the mother. Accurately performs urinalysis. It's an antenatal scenario, so you may perform urinalysis. Sometimes they will tell you that it has been done already and you don't have to do it, but you should prepare yourself to like go into the exam thinking that you would actually perform urinalysis. So it helps you to manage your time more. So while after you've assessed your mom and the baby, you want to ask her, the next thing is to go down to vaginal losses. Okay, so while all of these things have been listed here, unfortunately I don't have a video of when I was practicing for mine. So but the best approach to it is to do it systematically, where you would, after you've done mother, you've done the abdomen, and then the next thing is vaginal, the pelvis. So under the pelvis, you're asking about, has she passed urine, does she want to pass urine now, and then you go on to do the urinalysis. And then under the pelvis, you're also asking about any vaginal losses, like has she had any vaginal losses. So vaginal losses could be, has she passed, has her water broken, is she still bleeding, has she seen her show yet, which other thing could be per vagina, has she peed, or has she broken her waters. Yeah, those are things that you want to ask under vaginal losses, so you don't end up missing anything out. So performs urinalysis. You would explain to the mom that you want midstream urine. You teach her how to go about that, how to catch the midstream urine, and then you use the urinalysis strip according to the manufacturer's instruction. So it depends, so just read whatever the manufacturer says and then go with it. Then you note your readings down, but we don't know whether you do urinalysis or not, but sometimes it's already been done and you don't have to do it, but prepare your mind to do it anyway. Differentiates between fetal and maternal heart rate. I mentioned that earlier. You have to verbalize that. I'm going to check the mother's pulse as well, so that to be sure that I'm not getting a false reading. And then cleans hands with alcohol rub, washes with soap and water, dries with paper towels, following WHO guidelines. Accurately documents all maternal observations on meals charts provided, assessing well-being and clinical deterioration using charts. Identifies any observations that are the cause for concern to the examiner, and that's pretty much that stage.
Apologies, I think I missed this 4 routes, but this is it's now. You can just go through it, and hopefully we'll come across it in subsequent
And
ones.
that's pretty much that station. So after you're done with the patient, you're done with the woman, you wash your hands again, and then you go back to your seats. And when you go back to your seat, you will have a meals chart on there already, so you have to complete your meals chart. If you've seen my previous videos, you would see that I've emphasized that for stations where you have to complete any document at all, the first thing you want to do is to get your initials at the bottom. You want to write your name, you want to write your initials at the bottom. So you complete the meals chart for this station, and then after you've completed the meals chart, we might probably do another video on how to complete the meals charts. But so after you've completed the meals charts, you would get like 2 ambers, 2 reds. What you would do is at the back of the meals chart already, so you would accurately document on meals charts, and then assessing the well-being or deterioration using charts. So if it is 2 amber, 2 red, we know what to do here. So this would inform the care that you want to provide to the woman, and then by virtue of this, identifies any observations that are the cause for concern. So any things that you think are a cause for concern, you'd verbalize it to the assessor, and that is where the differential diagnosis comes in. So at the end of this station, you're coming up with one or two differential diagnoses, and then you tell the mom. So after you finished assessing the mom, of course, you reassure her and tell her that, mom, after my assessment, this and this are what I found. You have the news chart revealed that you have 2 ambers and 1 red, and in such situations, what needs to be done is, if it's 2 ambers and 1 red, okay, so it says 2 ambers or 1 red, inform the midwife. I'm just going to inform the midwife. I'll inform the obstetric. I'll do an immediate referral to the obstetric registrar. I will increase your frequency of observations to every 30 minutes, and I will ensure you are reviewed within 30 minutes. I'll consider a review by the obstetric anesthetist, and consider a review by the
obstetric consultants.
So when you're done with your assessments, you tell the woman what you have found, and then you tell her what you will do. You reassure the mom and tell her that you should be attended to as soon as possible. Then you go on to your assessor, and then you tell your assessor, you give like a mini SBAR handover to your assessor, and then you let her know what your differential diagnoses are and what you will do. So basically it's going to be something like, I'm Allergy, the midwife, looking after Amy Hall. I've assessed Amy Hall today. She came in with vaginal bleeding after sex this morning, and then she's been having pain alongside. You just give a bit of the situation, of the background, and then you'd go on to tell the assessor what you've done or what you did. So I did a temperature. Temperature was this, pulse was this, respiration was this, BP was this, and then our meals chart was 2 red, and meals chart was 1 amber and 1 red. And in this situation, I'm thinking she might be having a UTI. Let's say she tested positive to leukocytes, or if it's pain, or whatever situation it is, if it's preeclampsia, if she probably had protein in her urine and her blood pressure was high. So whatever situation it is, you want to verbalize that to your assessor. And then you also go on to tell your assessor, okay, you told your assessor the differential diagnosis, yeah, then you go on to tell your assessor what you want to do at that time. So what you want to do is already listed at the back of the news chart. That's like the recommendation. So I'm going to just inform the midwife in charge. I'm going to do an immediate referral to the obstetric registrar. I'm going to increase the frequency of observations to every 30 minutes. Whatever the situation is at the back of your news chart. And that's pretty much that station, to be fair. So the station finishes with the handover to the assessor. So that's pretty much the assessment marking criteria. So we'll just go quickly to the labor and birth API. Before I continue, have you subscribed? Have you liked? Have you shared? Okay, if you have not, please go on to like, share, subscribe. So for this station, what you'll be needing is going to be the pathogram. That is what you'll be completing in this station. So this is a picture of the pathogram. So the first thing here says, introduces self to the woman, stating the role, name and role. We've said that already. Checks ID, we know that. Cleans hand, we know that. Reviews history, we know that. Confirms background, we know that. Gains consent, we know that. Demonstrates appropriate infection control practices before and after assessment. So basically, you're thinking of discarding your PPE appropriately. You're thinking of washing hands before you do assessment, because in this station you'll most likely be doing a vaginal examination. So for this station, things you want to bear in mind are that, number one, you want to note the time the last vaginal examination was done, and this would inform whether you will be doing a vaginal examination or not. People fail this station because they fail to realize that a vaginal examination was last done at 5:30 in the morning, and then this is 9:30. There is a 4 hours gap in between. which means that you should actually do a vaginal examination. But sometimes people don't pay attention to the time, and you go through the assessment station without doing a VE. That means automatically means a fail to the assessment station, and not just the assessment station, the planning station also goes along. It's also going to be a fail because you haven't assessed correctly then, which means you can't plan correctly. So that is one thing you want to bear in mind in this station. Pay attention to the time. If there is a 4 hours gap, go on to do a VE. Don't forget. Undertakes an abdominal examination and palpation is pretty similar to what you do in the antenatal scenario. So you're checking for, in this station you don't need to do a symphysiofundal height because the woman is in labor already. But of course you do your inspection and then you palpate. You want to know the lie, the position, the descent, the engagements. And then for this station, because she's in labor already, you want to count the contractions in 10 minutes. In 10 full minutes, you want to count the contractions in 10 full minutes. And you ask your assessor, you tell your assessor what you're looking for. Most of the things you'll do in this station will be verbalization because it's going to be a mannequin. So so you tell your assessor, you check for contractions now. Is it strong? Is it mild? Is it moderate? How long did they last for? How many is she having in 10 minutes? Those are things you want to note while you're doing your abdominal examination. And just like I mentioned earlier, for the antenatal scenario, after the maternal observations, just do it in a systematic way so you don't forget. So you do the maternal observations first, and then you go to the abdomen, and then you're asking about vaginal losses. In this station, if you're getting the labor API, you're asking for fetal movements at least twice, a minimum of twice. For any gravid woman, just ask a minimum of twice. Before your assessment and after your assessment, ask the woman, can you confirm, do you have any concerns with the baby movement? Is baby still moving fine? Do not forget, ask about fetal movements. People have failed this station because they did not ask about fetal movements. Okay, yeah. So assesses fetal well-being is pretty similar to what you do in the previous station. What you would do if it was antenatal, you're still assessing the fetal well-being. So you're listening with PNAD, you're counting and double checking with the maternal pulse. Do not forget. Then accurately records all maternal and fetal observations on the pathogram. So I showed us the pathogram earlier, and I'm sure we'll be pretty familiar with completing this. In all honesty, I would say the way you used to complete it, like back home, maybe your wherever you've trained, whatever country you've trained, is pretty much the same way you still have to complete it, to be honest. Because I know someone who failed the station because somebody told her like some new way of completing it, and then he ended up mixing things up, and she ended up completing it wrongly in the exam. And when she told me about it, I was so like, as far as I know, it's still the same pathogram, nothing changed. The only difference I know is that this one doesn't have the alert and the action line. That's like the only difference I can see in this pathogram and the pathogram that I trained with. So you can look at videos online on how to complete it, but try not to get yourself confused. And whatever videos that you watch, just try to practice as many times as possible so that you are confident in what you are doing. So the next thing is considers the full findings of full intrapartum assessment and discusses findings with the woman. So just like we did earlier, when you've finished your assessments, you still go back to the woman and you tell the woman, okay, after my assessment, this and this and this was what I found. This and this and this is what we'll do now, and all of that. For most times for this station, the situation is always prolonged labor, delay in progress of labor. So you could have a situation where the woman was 5 cm when she was assessed 4 hours ago, and then you've done the assessment again, it's still 5 cm. So that is like something is wrong. So that in itself is like the differential diagnosis that you could get out of this station. Another differential diagnosis could be pain, because I mean she's having labor pains, so you want to consider analgesics for her and all of that. When we are doing the VE, we know the things to look out for already anyway. We've done lots of VEs, but like I'll just mention it again. So you want to check for the warmth of the VJCT. Before YouTube will flag my video, the way I just keep throwing the word around. Oh God I beg. So you want to check for the warmth, you want to check for is the membrane still intact, you want to check is she effaced, is she dilated, how dilated is she, you want to check if there is any losses, you want to check for the descent, you want to check for the presentation, you want to check for the presenting part, you want to check if molding has taken place. Yeah, so those are things you want to check. And then after that, you go back to document on your pathogram, and then you hand over to the assessor. You let the assessor know, okay, this and this and this were what I found. So you do your with SBAR, of course, the situation, the background, the assessment, and your recommendation. So you if it's a delayed if it's a delay in progress of labor situation, you want to consider that you would you want to verbalize that you consider amniotomy, an obstetric review as soon as possible or within 30 minutes max. You do another examination in 2 hours. So those are things you want to mention on there. The last thing on here says act professionally throughout the procedure in accordance with the NMC. So that's pretty much the labor and the birth API. And we go on to the last but not the least, which is the postnatal API. And the last but not the least, which is the postnatal API, introduces self to the woman, stating name and role, we know that already. Checks ID with the woman, we know that already. Cleans hands with alcohol rub, we know that already. Reviews history, confirms situation, we know that already. Confirms background, medical history, antenatal and intrapartum care to date. It's pretty much the paperwork is going to inform what you're asking. Gains consent and explains reason for postnatal check. So let the woman know it's day 2, day 3, day 4, day 5 postnatal check, and it's important you do this check and all. Completes a full postnatal assessment and verbalizes maternal observation. Inquires about perineum and breast comfort. Just occurred to me, looks like there's a video we've not done postnatal care scenario. I totally forgot that part, you know. So you ask the woman about the perineum, lochia. You ask her to describe what it's like. If she doesn't have any concerns with it, you actually don't have to tell her you want to see the pad. It's best practice not to see or ask to see the pad if the woman doesn't have any concern. Then you ask about breast comfort. Is she engorged? Things you want to ask, things like that. Considers and discusses the woman's mental health and well-being. So you want to ask the woman about generally how is she doing okay, is she getting help, is she sleeping when baby sleeps, is she eating and drinking well, was she happy about her birth experience. Like you just want to explore other parts of the woman and not just the temperature, pulse and respiration. Like provide holistic care to this woman. Accurately documents all maternal observations on meals charts provided, assessing well-being, clinical deterioration using charts. So for this station we are using the meals chart as well, and you would see that on the meals chart there are some columns that it's for postnatal situation. So you're thinking of things like lochia would come under here. Then accurately completes meals chart, signs, dates and heart time and monitoring frequency on assessment charts. So don't forget to write your name at the bottom, the escalation and all of that. Identifies any maternal observations that are a cause of concern to the examiner. So after checking, and then you see that she had maybe one red, you want to escalate that, you want to address it appropriately by following what is at the back of the meals and doing that. Addresses health education sensitively to include healthy eating and fluid intake, resting when tired, breastfeeding advice, postnatal exercise including pelvic floor exercises, and care of the perineum. So while you're asking, I mentioned earlier that you're not just focusing on CPR and BP, you're asking mom about other aspects of her life. And while you're asking that, you're not just asking for asking sake, you are also providing some like form of health education. If you ask her, so has she been resting well? And she says, I've not been able to rest at all. Baby has just been crying all the time. I've not even been eating and drinking well. I want to encourage that, oh mom, it's absolutely normal to experience this, but you have to try. You can consider things like resting when baby is resting, consider things like drinking a lot more, and then, oh mom, you know that while you were having your baby, the pressure on your pelvic, it's going to be important that you do a pelvic floor exercises to help the pelvic floor muscles to regain their tone, and this is how to do it. So like during your assessment, you have to identify one or two areas of health education and provide good health education on it. And then you want to tell her about care of the perineum, care of the lochia, what the lochia should look like, and then how she should change her pad frequently so that she doesn't get a perineal infection. So identify just like some form of health education. Recognizes that the plan of care is required because of the abnormal findings of the maternal assessment. So verbal communication is clear and appropriate, and then of course you let the woman know what you found out, and then you also you also give a form of SBAR handover with differential diagnosis to the assessor. So differential diagnosis you could get in this station could be things like mastitis, feeding issues, perineal infection. Let's say they said lochia is foul smelling, she looks unwell, she says she's engorged or she's struggling to feed. So those are possible situations, possible differential diagnoses you could get from this station. But there is no, I don't have any scenarios here. I don't know what scenario you get. Well, this is just like a guide as to what to know and what to expect regarding the examination. So that's pretty much the assessment station for the postnatal. But before I leave the postnatal, I would just like to give us like a kind of acronym on the questions that we might probably want to ask, that you don't want to miss asking from the woman. This would also be relevant, it's going to be useful if you're having the postnatal check scenario. You know what, I think I'm just gonna do it in another video. So that's pretty much what the assessment station is. I hope you find it useful. Don't forget to master how to complete your meals chart. If you want me to do a video on how to complete the meals chart and the pathogram, please let me know in the comment section. Don't forget to like, share, subscribe. Till you see me again in my next video, I remain your darling Omobeejay. Remain in God and God bless you. Bye.